What's up, YouTube? I'm back today with another video. I was sitting there drinking my water this morning, or my juice. As you can see, I don't have water because water makes me nauseous. But I was sitting there drinking my juice this morning, trying to get my liquids in for the day. And I'm thinking to myself, I didn't get my liquids. I'm feeling mighty thirsty this morning. I didn't get enough liquids the past couple of days. I don't think I did because I'm starting to feel it. I'm starting to feel the dryness and the throat itching and just not feeling myself, like when you feel a little bit dehydrated. And it made me think I should probably make a video about dehydration and what it looks like after you have bariatric surgery, because it is way harder to get your liquids in now that you have had the surgery, since you have this much of a stomach. So I'm just sitting here trying to get this drink in, and as y'all know, if I don't sit it right in front of me all day long, I will forget about it, and then I'll be scrambling around at the end of the day trying to drink it. And some days I just can't get all of it. So there's been days, the last few days, that I have only gotten maybe 32 ounces of water. And it doesn't take long to get dehydrated, let me tell you. From what my doctor has told me, and from what I felt firsthand, you can get dehydrated in 3 days and end up in the hospital needing to get saltine, what are those bags, electrolyte bags, pumped into your veins to rehydrate you. And I don't want to have to go to the hospital and get rehydrated, okay? So I'm just trying to find ways to drink more water. In this video, we are going to discuss what hydration looks like, or dehydration. What does dehydration look like in a bariatric patient? So if you're interested in having that discussion or hearing more information about that particular subject, please stay tuned to the end of the video. So let's talk about what causes that dehydration. As I already mentioned in the beginning, our stomachs can only hold a small amount of fluids or food or anything at a particular time. So I think our stomach can hold about, 12 ounces of liquids, like early on when you first get your surgery. I'm 2 months out. So at this point, I can say my stomach will probably hold about 12 ounces. I could drink a full one of these in one sitting. So this is 11 ounces, this particular shape. So I can drink 11 ounces worth of liquids in one sitting. So, which is why I can probably knock one of these out by, and that's if I remember to drink. If I remember to drink, I could probably knock a whole bottle out in maybe an hour and a half. If I'm really just drinking and paying attention to myself drinking. It's not that hard, but there are people who have had the surgery who have had a harder time keeping liquids down at all, or who have maybe a smaller pouch than I do, or a tighter pouch, not necessarily smaller, but tighter, and have a harder time getting that amount of liquids in. So they have to drink like every 15 minutes. They should be sipping every 15 minutes. They have these little cups, these little plastic cups that you got from the hospital when you first had your surgery. They give you those, and you're supposed to drink, I think they're like 1 or 2 ounces. You're supposed to drink one of those every 15 minutes, and you have to keep a schedule of those drinks. Plus, nausea, which is what I dealt with, plays a role in how hard it is for you to get your waters in. So if for whatever reason you can't drink water straight, go and get you, I have these this drink mix. I squeeze a little bit into my bottle, and I get the flavor of the Mio. This is a fruit punch flavor. So I get a fruit punch flavor, and it allows me to get the liquids in that I need without the struggle of the nausea. I don't know why. Sometimes water can cause nausea, but it does. So don't let that be a deterrent for you not drinking the water that you need. I understand it's hard already to get it because your stomach is small, but you can make it a little less difficult. Try putting some drink mix in. That'll allow you to get it in easier. So that can be one less issue. Next is another situation that I was dealing with earlier. So if anyone has been keeping up with my videos, you know that earlier in my journey I was struggling with diarrhea or loose bowel movements. So of course, if you're not putting any water into your body or any liquids into your body, excreting or losing liquids would obviously cause you to be dehydrated. And earlier in the journey, whether it's gastric bypass or whether it's VSG, because of all of the extreme turmoil that your body is in after having surgery. Your body's trying to recover. Your digestive system has had huge changes made to it. So it's going to take a period of time to for your body to go back to a normal routine, or to get used to the new routine that it currently has. So that may cause your body to reject food, which would be the dumping syndrome that doctors warn you about with food. You have to be very careful of what you're eating, or it can cause you to vomit. It can cause you to have extreme stomach pain, or even have loose bowel movements, which is your body just trying to remove the food from it as quickly as possible. And that can cause you to lose some water out of your body. And if you're already dehydrated, it's going to be a hard time for you. This is normal. If you have had diarrhea in the beginning, this is normal. So expect that. If you don't have it, that's great, but there's a good possibility that may happen at some point in time during your getting used to foods again portion of recovery. And that's why it's so important for you to be hitting your numbers for your water. So just keep those cups and keep sipping. So here are a few signs that will tell you that you may be dehydrated. Okay, so look for these. If you're feeling any of these, make sure you think about how much water you had for that day, okay? So first thing is going to be dry mouth, which is what I was just experiencing a few minutes ago. My throat and mouth feel really dry, almost like cotton mouth, which prompted me, that's my reminder in a way, to drink water. But you should be drinking way before you feel any of that. So the next thing you're going to want to look out for is dark colored urine, which may be deceptive, because I don't know if any of you take liquid calcium or if all calcium does this, but certain vitamins that I take at this point causes my urine color to change, which could make you think that you're dehydrated, but that's just a natural reaction to the different vitamins. So I know specifically the calcium vitamin makes my urine like almost neon colored, which is crazy, and it's the same thing that my mom had going on, so it's a normal reaction, I'm assuming. Let me know if you guys experience that too. But a major indicator for dehydration could be darker colored urine, and usually a urine that has an odor to it also could be an indicator that, hey, there's some toxins going on in my body because I'm not getting enough water. And also decreased urine volume could indicate dehydration, because if you don't have a lot of liquids circulating through your kidneys aren't going to expel as much urine because there's no liquid to pull from, right? So the next thing to look for is dry skin. And also, my skin isn't that dry. Well, okay, so I do have a dryness that you guys always see here on my face. That I don't think is directly connected to dehydration, because other than the last few days, I've been pretty good with hitting my numbers. Now, I could probably use more water, because even though our bodies have changed in terms of our digestive system, our weight is still where it is right at this moment, at least until we lose the weight that we're supposed to lose. But at this current moment, our body still requires more than 64 ounces of water. That's the bare minimum in order to keep from being in a hospital. Basically, to keep your body doing its basic functions, you need minimum 64 ounces of water. But the more water you get, the better. So technically, our body's requirement for water is going to vary based on our weight. And because we are overweight for the size our body is supposed to be, our body requires a higher amount of water. So I'm thinking, because, okay, at this point I'm at 258, I think it was 258 my last weigh-in. That means that my body would probably require like 90 or 100 ounces of water. I think I was close to like 115 ounces of water that I needed before I got the surgery. So that's the amount that your body would need to really get the full benefits of having water in your body. Like, so the nicer hair and your skin complexion is richer and less dry, and your skin has less acne. A lot of good benefits come from drinking more water if you can, but at the bare minimum you need 64 ounces. I'm getting off topic, sorry guys. So the dry skin, that's where I was going. I started with the dry skin conversation. And also there's this test that you can do on your skin. It's a test that you basically are going to grab a portion of skin on your hand, or yeah, they said on your hand or on your arm. So a portion of skin on your hand or your arm where you have a little bit of excess skin, squeeze it to see if it pops back quickly. Okay, like that. So if it pops back quickly, then that means that there's a good chance that you're not dehydrated. But if it kind of goes back slow, or it doesn't fully retract back at all, then that's good. That means that you may need more water. So that's one. And a big one, a main one that I need everyone to be careful of is lightheadedness. That is a huge red flag that you may be dehydrated. You may get like if you're getting up out of a chair or on a bed or something like that, or you just standing and all of a sudden you start feeling lightheaded, that's an indicator that your blood pressure may be going down and you need electrolytes immediately. So if you have any electrolyte drinks, that's probably, if you don't have any electrolyte drinks, I would suggest maybe going and purchasing some to have on hand, because like I said, dehydration is real and can very easily happen to us because we can't get in as much liquid as we used to. So it would be beneficial for you, let's say that. It would be beneficial for you to keep some sort of electrolyte drink around, a Pedialyte, or I keep Body Armor in the house, something that you can get to quickly to help level out your blood sugar, not your blood sugar, your blood pressure, something to help level out your blood pressure, so that you, or if you don't have that available, call the hospital, go to your closest medical facility and get that taken a look at, because you need to take a look at that. That's extremely dangerous if you don't, because you can fall out and faint and hit your head on something. It could be very bad. Okay, so you definitely want to make sure, if you are feeling lightheaded at any point and you take an electrolyte drink, say you drink it and it doesn't help, or you don't have an electrolyte drink, you need to contact a medical professional and get that taken care of immediately. Okay, so don't wait on that, guys. So basically, yeah, that's pretty much all that I have at this moment. Indicators that I use to determine if I'm dehydrated and if I need to really hone in on drinking more water, because that is 85 to 90% of this journey, is getting enough liquids and getting enough protein. That is 80-90% of the journey. Okay, yeah. And you can't really, and also I found out, this is just a little extra tip, but your protein levels being too low and you being dehydrated or having not getting the minimum amount of water that you need a day, both of those can cause stalls, okay, in your weight. That can cause stalls, and it also can cause you to have looser skin at the end of the journey. If you are dehydrated, your skin is not elastic the way that it needs to be. Okay, hydration and elasticity in skin go hand in hand. Okay, so if your skin is not hydrated, the elasticity in it is not going to be functioning at its optimal level, if that makes sense. So I'm not saying that it's going to fully eradicate loose skin, but it could potentially lower your chances of having loose skin, because your skin is in its tip-top condition, if that makes sense. So it gives you the best fighting chance at lessening the loose skin that you have on your body. Let's say that. But I'll recover that in a video separate from this one, loose skin. That's a whole nother video. But anyway, thank you so much for stopping by today. If you like this video, make sure you hit that like button, subscribe, and follow me on Instagram, where I'll be dropping more information. And I hope you guys have a wonderful rest of your day. Make sure you get y'all water in. See you in the next one.